Minister, I want to return, first of all, to the issues that arose yesterday at the COVID Response Committee and the two particular questions that I posed to HICWA. The first one was in relation to the infection control reports, where they had been doing annual assessments and there were repeat kind of offenders, if you like, people in nursing homes that there were particular concerns about. And we're told by the Chief Inspector that in February and March that list was sent to the department, drawing attention to their concerns in respect of COVID and poor infection control standards. Now, you made some reference there, you talked about the 13th of March. It was said that the letter went to you in February and in March. Okay, details went to you then. But 13th of March, so that's within the first 2 weeks of the virus. So, I mean, can you tell us what action was taken on foot of that? I mean, these were flagged to you as 19 nursing homes about which HICWA had serious concern. So can you be a bit more explicit about what was done at that stage? Surely alarm bells should have started to ring. The second question then that I posed to Mr Quinn was in relation to this point that HICWA have been making consistently, that they had serious concerns about the lack of clinical oversight of the nursing home sector and private nursing homes in particular. Again, when I put the question to him, what did he do with those concerns? He said that he would have been in touch with the department on several occasions in relation to those concerns. I'm asking you now, what happened to those concerns being raised about the manner in which the nursing home sector operates and the fact in an extraordinary way that there is no clinical oversight of private nursing homes catering for the most vulnerable in our population. So what did your department do, if anything, in response to those serious concerns being raised? The next issue I want to go on to then, and you might just answer all of these together, or sorry, maybe you'd come in on those two first, Minister, and I'll come back to you then.
Yeah. So the letter, so I'll have to check on February because my note says the 13th of March, but I'll revert to you, Deputy, in relation to that. I'm not doubting what Mr Quinn said, but on the 3rd... It
was the Chief Inspector who said it.
Oh, sorry. Sure. So on the 13th of March, there were 19 sites identified by HICWA to the department as multi-occupancy rooms creating infection prevention challenges. And I don't mean this in any sort of smart way when I suggest, I don't think it would come as a surprise to anybody in the department, the HSE, that multi-occupancy rooms obviously have extra infection prevention challenges. On the 13th of March, the same day, that information was sent on to the HSE, and Dr. Colm Henry wrote back to the department. I'm sorry, just in the interest of time, I'm good, but basically wrote back to the department in April saying, please forgive the delay in providing you with a response. As you know, our engagements with you on the issue have been ongoing since then. I appreciate the items requested are now discussed daily, but I'd like to share the requested information with you. And then he goes on to, regarding the list of HICWA identified residential centres with multi-occupancy rooms, I can assure you that all centres mentioned in your communication are included in the ongoing implementation of the specific capital plan for the redevelopment. Progress has been made to enhance these environments. At the time your query was received, and he goes through each of them, so I think in the interest of time I should share this with you. But there was very clear actions taken. There was very clear action taken. Yeah, let's debate that in due course. But I would point out that on the 31st of March, NEFIT itself put in place a range of specific public health actions for long-term residential care facilities and home support. So there were 2 special meetings of NEFIT specifically dedicated.
We're just talking about the 19 in particular that were highlighted, and what specific response was there?
But it's about a lot more than the 19 because we have. So I've answered that. Dr. Colm Henry wrote back to the department, but I am making the point because it wasn't made yesterday that it was NEFIT who requested HICWA to carry out that risk assessment. I think that is an important piece of information.
I don't actually think that's accurate. This was based on a series of infection control assessments that had been done over a number of years.
So on the 30th, so just to be really clear, Deputy, because I'm not, maybe we're at cross purposes. Maybe we're both right. But on the 31st of March.
Let's read the letter.
On the 31st of March at NEFIT, these are all published in minutes, a HICWA was asked to risk assess all nursing homes by NEFIT. Sorry.
That doesn't answer. Look, let's leave that. And the other one about the lack of clinical control.
Excuse me a minute.
The lack of
in order to
clinical
conduct the
oversight.
debate in some kind of an orderly fashion, well, one speaker at a time.
Yeah, okay.
I mean, the deputy is correct. It's a long known fact that, and indeed the Sláinte Care Plan speaks very much to this, the lack of integration between our nursing homes and the HSE in general, be they public or be they private. Now, I think GPs and others would have a different. I'm not sure they'd fully accept the view that there's no clinical involvement or clinical governance, but I do think it's a shortcoming in relation to the long-term residential care setting in Ireland, and I do think it's something that needs to be addressed.
To that. Okay, the other issue I want to raise, Minister, is the question of mental health services and the review or refresh of Vision for Change. And several of us have raised this with you previously. And you've responded that while the review was completed and passed by government and all of that, going back December, January, that it isn't your intention to publish that. Because you'd be criticised for it. And we know now that just today that a letter was sent to you representing Fianna Fáil, Sinn Féin, the Green Party, the Social Democrats, and then afterwards a couple of the independent groups, calling on you to publish the review of a Vision for Change. And I just got word there that actually Minister Daly has written to you also, urging that you would publish it. Now, you know, you have political support for doing that. And I'm putting it to you now, Minister, given the urgency of the situation in relation to mental health services, that you would commit to publishing that review. Everybody wants you to do it. Nobody's going to complain or criticise you for doing that. And will you now today commit to publishing that immediately? And the reason I'm saying that it has to happen immediately, apart from the fact that there's, been a delay of several months, but we are now facing into a situation where the level of mental health problems are really, huge at this point, not only in relation to ongoing issues in relation to mental health, but COVID-specific issues that are arising right across the population. And, we know that that's the case in every age group. We know that for older people, in particular cocooning, older people in nursing homes, there are huge kind of levels of stress there. Stress also in relation to the impact of COVID on family members. Stress for frontline workers who, by the nature of their job, are under enormous pressure and stress, which result in issues about mental health. We know also in relation to young people in particular, and the fact that there are huge question marks over their futures, their education, the restrictions on their social lives and so on. So right across the population, COVID is having a huge negative impact on people's mental health. And for that reason, it's really, really important that as a matter of urgency, the review of Vision for Change is published, the implementation group is established, and that implementation group draws up an immediate response to the immediate problems arising from COVID, and then also the medium and longer term responses. So I would strongly urge you to publish it immediately. Thank you, Minister.
So when you're health minister, you get criticised probably 10 times before breakfast, and often rightly so. So I'm not afraid of criticism in relation to this. But it hasn't been to government. It has been to a cabinet committee. It hasn't been approved by government. I find it very hard to mount an argument to what you've said, though. Actually, quite frankly, so I will give a commitment to revert to you by the end of this week to see if it's possible to bring it to government. I'll have to get permission to bring the policy to government. I do believe an early publication of this is important, and a very quick publication of it for the reasons you've outlined. I know that mental health reform make the point that they don't really want to see, not to speak for them, but they don't really wish to see kind of another ad hoc or willy-nilly process put in place. They need it to be aligned to Vision for Change. That makes sense. And they told me that when I met them. I haven't seen the letter from all party groupings, but I'll respond to that by the end of this week with a view to seeing if I can get permission to bring it to government immediately.
You say that there's lots of different proposals being made by people because there's such anxiety to have an immediate response to the large-scale mental health problems that are emerging now, as that we can see all around us. So, there's no point in setting up task force or different subcommittees or whatever. This should be the main implementation body for our mental health strategy, and that has to be put in place at an early stage. So I very much welcome your commitment and look forward to positive news next week. Thanks, Minister.